Hi. Is it okay if I come in? It's nice to meet you. I'm Dr. Heather. You seem a little bit shaken. My nurse tells me that you've been experiencing some pretty distressing symptoms. Is that right? Okay. Well, I can tell you that you are absolutely in the right place. First of all, if you wouldn't mind just telling me a little bit more about what you've been experiencing, I would love to see what we can do to assuage that and make you feel a little bit better today. Okay. So what's been going on? Just tell me a little bit about when this started, what you've been feeling, and we'll go from there. Okay. Okay. Are you on any medications that I should know about? Okay. Are you seeing any other doctors, specialists, psychiatrists, psychologists, anything? Okay. Okay. And have you ever experienced symptoms like these before? Okay, so it's been a long time. Absolutely. So tell me a little bit more about your day-to-day life right now. Are you exercising regularly? Okay. How would you say your eating habits have been? Do you stick to any kind of diet specifically, or just kind of eat, whatever's kind of available? Okay. What about drugs or alcohol, whether legal, not legal? This is a no judgment zone, I promise you. I just want to get to the root of what's bothering you today. Okay. Okay. And before you came in here today, were you, doing anything particularly vigorous? Had anything happened that was very stressful? Anything like that? Okay. So from what you're telling me, it sounds like you've been experiencing some chest pain, some tightness, maybe even a little bit of shortness of breath, and a little dizzy, lightheaded feeling. Brain fog, absolutely. Okay. Well, like I said, you are in the right place, and I take all of these concerns very seriously. I will tell you that I think it's unlikely that we will find anything. I know you mentioned heart attack, stroke, things like that. I think it's more likely that this is something else, and I'm not worried at this time, and I promise you I would be honest and tell you if I was. But at the same time, like I said, I do take these concerns extremely seriously, and we will investigate all of them thoroughly for your peace of mind, as well as to rule out anything serious. Okay. Absolutely, you can trust me. Okay. Great. Well, let me get ready, and we'll go ahead and do some examinations that will rule out any of these serious complications one by one, okay? Great. All right, you sit tight. I'll be right there. So I'd love to start by just taking a deep breath in together. Letting it out slowly. Once more. And out. Perfect. And I'd love to just take your vitals, if that's okay. If you don't mind just stretching out your forearm. this cuff around it. Beautiful. And just breathe normally while I squeeze this little ball. Your blood pressure is within the normal limit. And now I'd like to take your pulse, if I could just have your hand. Okay. Your pulse is slightly elevated, but that's absolutely what I would expect for someone who's been feeling the way that you're feeling, so I'm not overly concerned about that on its own, okay? Yeah, just very slightly. No, it's not tachycardic, which is what we would call it if it was, extremely fast, more like a hummingbird. But no, it's not concerningly fast, especially considering that you're obviously feeling very anxious about what's been going on. Absolutely. I'd love to listen to your heart and lungs now. If you wouldn't mind briefly lifting your top, just so I can get a good reading. Okay. Starting on this side, just breathe normally. Okay, and the other side. Okay, a little lower. Okay, and this side as well. Okay, and now just take a big deep breath in for me. Release it. Okay, your heart and your lungs sound clear. There's nothing worrisome there at all. So the next thing that I would love to do is just check for any kind of muscle tension or digestive issues. I don't know if you've ever had this, but I certainly have had sensations where I've had back pain or a stomach ache that kind of radiated into my chest and made me feel like that's actually where it was when it was really originating from somewhere else in the body. So I'm going to just gently press on your abdomen. Are you feeling any pain here? Okay. What about a little lower? Okay, and then in the center of your chest, anything when I press there? And what about the sides? Okay, so a little soreness here. Okay, no, that's very common when it comes to stress, especially if you've been suffering with anything particularly, difficult going on in your life lately. Okay, absolutely. So I would love to do a shortened version of a cranial nerve exam. If you can stick your arms straight out in front of you. Okay, they look very even, which is a great sign. And just push them up as I push down, okay? Okay. Okay. And then can you raise your shoulders? And don't let me push them down. Good. Okay. And I'll have you pull a few faces for me. Can you smile really big? Perfect. Can you stick your lower lip out? Good. Can you stick your tongue out? And wiggle it back and forth? Good. Okay. Can you blink for me? Okay. Now your right eye. And your left. And I'm gonna just use this hammer to tap on your knees and elbows and check for your reflexes, okay? Okay. Good. 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 And good. You're doing very well so far. Now I'm just going to gently touch your face in a couple different places. And you let me know where you feel it, okay? So close your eyes, please. Good. 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 So everything is looking very clean so far. I would like to take a couple of extra steps just to rule out a stroke or heart attack, since I know that those were some of the big concerns that you had come in with today, okay? Wonderful, okay. Give me just one moment. So, one very effective way to check for a stroke is to check your speech and how the brain controls it. If you wouldn't mind repeating after me and say, "Today is a sunny day." Okay. Dr. Heather is my favorite doctor. I enjoy lollipops. Great. Well, that compared, in conjunction with your muscular ability to, keep your arms level, keep your shoulders up, things like that is a very good sign. Last thing, would you mind just standing up for me briefly? And could you just do a quick turn for me? Okay. And if you wouldn't mind standing on your right leg. Good. And your left leg. Good. Okay, your balance and coordination look great. Your speech sounds perfect. I am not worried at all about a stroke. And let's just rule out that last serious, I would say, complication, and do one more quick heart exam, okay? So I'd just like to examine your chest muscles one more time and see if the pain has changed at all, okay? So I'm gonna press right here. Any pain here? What about on the outside? The way that the pain is presenting for you is very much indicative of muscle tension and stress rather than anything heart related, okay? And as I said, compared with, in conjunction with the heart evaluation that we did earlier, checking your heart rate, your heart sounds nice and healthy and strong, and you're not in any kind of age range or any other, risky group, I would say, for heart-related illnesses at this time. So I think that we can absolutely, with confidence, rule out a heart attack, okay? So we have learned that your heart is healthy, your brain and your muscles are functioning as they should, your balance and coordination are good, your speech sounds perfect, your lungs sound great. I think that we can confidently put a label on this as a potential panic attack. And I want to stress to you, I do really understand how real and serious this is for you. It's just as scary as having a heart attack or a stroke. It doesn't matter, that you're not in physical danger. It feels like you are. Have you ever spoken with a therapist before? Okay. And why did you stop going? Just, I know everyone has different reasons. Okay. Have you ever tried any sort of medication for stress, for panic disorder, anything like that? You have? And how did that work for you at the time? Did you have any negative side effects? Okay. What I would suggest is giving you a low dose of that medication just to, help you out for the next few months while you're going through this stressful time at work. I would also strongly consider returning to your therapist. And, it doesn't have to be constant. It could be once a week, once every 2 weeks, just to have someone to help you on more of an ongoing basis. Obviously, I'm sure you don't want to come in and see me every 2 weeks, although I would love to. But I can also give you referrals for other wonderful therapists that are in network with your insurance if you aren't interested in seeing the one you were previously talking with. I'd also love to just have you stick around for a few more minutes, and I can talk you through some breathing techniques and maybe other stress-related techniques. But first, I would love to just gauge how you're feeling. Do you feel confident in my assessment that this is not a serious physical manifestation of a disease? Wonderful. That's ultimately the most important thing, is your peace of mind and your understanding. So I'm very glad to hear that. Absolutely. Well, what I'm going to do is I'm going to come back in just a couple of minutes with a prescription for a very low dose of that medication that you were previously on. And you can get that filled actually right outside in our pharmacy. And I'm going to bring back with me a booklet that we have on stress relieving techniques, as well as some suggestions for wonderful therapists, including one that I have seen in the past for myself. And you have my phone number as well, so please feel free to call me whenever you need. I'm available for house calls, anything. I just want to make sure that you are feeling 100% or as close to it as we can get you. Perfect. Well, give me just one moment and I'll be right back with all those items, and we'll get you on a path to feeling a lot better. Perfect. Wonderful. Well, I will see you in just a moment.